Well, welcome everyone to this webinar. Good morning and good afternoon and good evening. And I'm Wafa El-Sadr. I'm the Global Director for ICAP at Columbia University. And it gives me great pleasure to welcome you to this very important webinar that we're going to be enjoying this today. We are very privileged and honored to welcome as our speaker today, Professor Emily Vraga. And I'm going to tell you a little bit about her and her expertise. So Professor Vraga is the Don and Carol Larson Professor in Health Communications at the University of Minnesota's Hubbard School of Journalism and Mass Communication. And her research has focused on testing methods to identify as well as also to correct misinformation, particularly on social media, and to build news literacy to improve the audience resiliency and also to encourage attention to more diverse content online. She has published extensively in journals as well as also peer-reviewed journals and other publications, and in the field of interdisciplinary fields of communication, political science, journalism, and public health. And she's been funded to do this work by a variety of different entities, including the National Science Foundation and the Andrew Carnegie Corporation as well. Her research has been widely quoted in a variety of different outlets, including major media outlets, including National Public Radio, Scientific American, the Washington Post, and the Atlantic. So it's a great pleasure to welcome Professor Vraga to share with us her insights and her expertise in this very important area of misinformation and social media. She will present first, and then after her presentation, my colleague, Dr. Jessica Justman, who's Senior Technical Director at ICAP, will moderate the discussion. In the meantime, anytime during the conversation, during the presentation or the discussion, please do submit your questions and comments in the Q&A box. So I will then hand it over now to Professor Vraga. Welcome.
Thank you so much for having me. I'm very excited to be here and to talk to you about this topic. All right, so when we're thinking about the question of health misinformation online, there are 4 areas that we need to discuss. First, I want to establish that misinformation on social media is a problem, that it's something that we should be concerned about. Talk a little bit about why it's spreading on social media, why social media offers a particularly fertile ground for misinformation, especially health misinformation to spread. Speak to the ways in which journalists contribute to misinformation on this topic. And then talk about some of the strategies for addressing misinformation. So we'll start with prevalence of misinformation on social media. First, it's important to recognize there's a lot of misinformation on social media, and this is true across a wide variety of health topics. The most commonly studied topic is vaccine misinformation. One meta-analysis from 2019 found that 33% of all vaccine content on social media could be characterized as misinformation. What's really important to stress about this is this was across a lot of different vaccine types. And although the study was published in 2021, the data comes from before the COVID pandemic. So we're looking at a misinformation landscape where vaccine misinformation is extremely prevalent. And that's even before a global pandemic supercharged attention to vaccines around the world. There are differences in vaccine misinformation depending on where you look. So for example, YouTube tended to have a lot of vaccine misinformation. But the other thing that's really important to note about this is even in our study of prevalence of misinformation, we're often limited to looking at particular platforms and by extension, particular countries. WhatsApp being a very closed platform is a space where we really don't have a good handle on the amount of misinformation that exists. Yet this is a platform that is very much used around the world and where we have reason to believe that misinformation is rife as well. Likewise, it's hard to study vaccine content on Facebook because it is a closed network, despite it being one of these prominent social media platforms. So we can extrapolate and expect that misinformation is prevalent there, but it's very difficult to test it. And this opens up unevenness in our knowledge about misinformation, depending on where we are and the kinds of social media platforms that people are using most frequently. This is true not just for vaccine misinformation, it's true for a lot of different types. So looking at cancer misinformation, another study came up with very similar numbers. So looking at the 200 most shared Facebook stories about 4 different kinds of cancer on Facebook, they found that 33% were misinformation. And many of those were harmful misinformation. Importantly, these stories that were misinformative tended to have higher levels of engagement. In other words, they were getting shared, they were getting commented on, they were getting favorited at more often than the factual stories. This virality of misinformation is something we'll turn back to in just a moment. I only picked a couple different examples to show you where we know a lot about vaccine misinformation. For example, most of the studies look at vaccines, but there's also studies of drugs and smoking, and less attention to other diseases, non-communicable diseases, communicable diseases. So at the time of this study, they were primarily looking at Zika and Ebola, but only about 10% of studies were even looking at this. Likewise, the places in which we're looking are very much still centered mostly on public sites and mostly on Western sites. So Twitter being an extremely common space in which we're looking for misinformation, in part because of the API and its availability to researchers, something that of course could change as the affordances of social media change. Why do we care about misinformation? Well, mostly because we have evidence people believe it. So again, just looking at the COVID study or COVID misinformation, a study from 2021 found that 8 in 10 Americans had at least one misperception or uncertainty about common vaccine myths. So 60% of people either thought or weren't sure whether the US government was exaggerating the number of COVID-19 deaths. 20% of people either thought or weren't sure that the COVID vaccine was going to change their DNA. So misinformation and misperceptions are a real problem. It's not a problem that is only on social media, but social media has several affordances, several features that makes misinformation especially likely to spread in these spaces. One of these features is information overload. There's just a lot of information online. So a couple months ago, I wanted to look to see whether my almost 2-year-old was ready for his 4th dose of the COVID vaccine. So I tried using a very elaborate search term, following kind of best practices, and immediately came up with 48 million results. That's a lot of information to expect people to sort through, to expect them to be able to understand what is credible information and what isn't. And so there's a lot of information out there. And what we find in general is that when there's a lot of content, it doesn't make people more careful. Instead, it's the opposite. Faced with information overload, people often make simpler decisions, rely on heuristics, and sometimes that leads them to believe misinformation rather than seeking out good information. Not only is there a lot of information, sometimes that information isn't exactly what we're looking for. So I went here with a very specific question. Is my 2-year-old eligible for a 4th dose of the COVID vaccine? Despite the 48 million results, it took me a while to actually find an answer I was looking for. The top websites were all advertisements from vaccine distributors, a source that a lot of people don't trust. Of course, vaccine distributors potentially have a bias in this, or at least a perceived bias in that they make money when people vaccinate. So if I'm looking for highly credible information, I was looking for, in my case, the CDC or the Minnesota Department of Health, a high quality government organization in my country that I knew I could trust. It took me a bit to get there, but I did find vaccines.gov, kind of scrolling down on the search page, something that we know a lot of people don't do. But clicking on that link actually took me through several different steps before I could find the answer to my question. First vaccine.gov, then the CDC, before I finally was able to find the information that I was looking for, that my toddler is not eligible or is not recommended to get a 4th dose at this time. So It's both a lot of information for me to sort through and sometimes hard to find exactly what I'm looking for. And when people can't find the information they're looking for, can't find the information they want, they often turn to the information they can find, which might not always be the most credible information. This brings us to a feature of social media that is both one of its strengths and its weaknesses. It's a rapidly changing environment. So I did this search 2 months ago and presented on it. When I went to search in preparation to talk to you today, when I searched that exact same term, the first site is now the CDC, followed by the Minnesota Department of Health, where I live, and minnesota.gov. So even in the past 2 months, the social media environment changed. And yes, there's still, in this case, 13 million results, but the top results are now the ones I'm looking for. So in some cases, the affordances of social media, the fact that what works one day doesn't work the next or works differently the next, can actually offer advantages for people trying to combat misinformation, filling information voids, making sure high quality content is easy to find and consume. Another challenge of social media is that there are fewer gatekeepers and fewer source cues. So traditional or older media environments, a lot of high quality information came from just a few sources. It cost a lot of money to produce information. It cost even more to broadcast it. So that meant that our media ecosystem was largely populated with organizations who are committed to high quality information. Not entirely, but more so than not. So you might find, for example, high quality information from journalists. David Montgomery is a journalist who does data journalism around the COVID and other topics here in the Twin Cities. Throughout the pandemic, he was somebody I followed religiously to know exactly what was happening in my area. And you can see that he has the little blue hash marks so that theoretically, I know that he is a credible source and that I can trust him when he tells me that COVID in our wastewater is declining. More recently, I went to Twitter and searched for COVID, and the very first hit I had was from the chief nerd. So this is me searching rather than this appearing in my feed, and Chief Nerd is making this claim that COVID vaccines has caused all of these deaths in 2022. What's important is, first, that this appears with the same kind of prominence. It looks the same in all of these features as somebody like David Montgomery, a data journalist committed to high quality information. Second, that blue check mark that a year ago meant that it was a verified account now simply means that they've paid at least $8 a month. And so a changing environment in this case actually induces problems. If I had learned that one of the indicators, one of the signals of credibility that I could rely on social media is looking for verified accounts, that's not a signal that is trustworthy on Twitter anymore. It is instead a signal that this person is paid for access. And so thinking about these differences is an opportunity as well as a weakness. Social media is also a space where misinformation can get more engagement than high quality information. So we saw that with the cancer topic. We saw that with the last example, looking, for example, at stories surrounding Zika. The same thing is true. Some of the misleading information, misguided information tended to have a lot more shares, views than anything else, or than high quality information like the WHO's press briefing on the Zika virus. One study looked at this systematically on Twitter. Again, this is from pre-pandemic and pre-changes to the Twitter landscape. And what they found is that falsehoods, things that were not true, spread further, faster, deeper, and more broadly than truth in all categories. So looking at health and politics and a lot of different kinds of information. And in fact, found that it takes the truth about 6 times longer to reach 1,500 people. And just overall, falsehoods are 70% more likely to be retweeted than the truth. So misinformation is very viral. And there's several reasons that they posited for this. First, misinformation is very much emotional. Social media and indeed other spaces, when we tap into people's emotions, people are likely to respond. It activates their desire to engage. So this is a strategic move that disinformation actors can make to make their content more appealing and thus spread more widely. Another feature of misinformation is that it can be completely novel. If I want to say something about COVID vaccination, for example, I'm bounded by the truth. If I want to make up something, I can say anything I want. And that might be something no one's ever heard before because I've made it up. And yet that novelty, that newness is something that people, again, attune to on social media, pay attention to, and spread. So the emotionality, the novelty of misinformation gives it advantages compared to accurate information that allows it to reach more people. Again, I can talk about a lot of different places in which we've seen misinformation. I just wanted to reinforce that that study is a few years old. This newer study looking at monkeypox from last year found very much a similar pattern of results, that misinformation is getting spread much more widely, much more quickly than accurate information. So this is not something that has been solved in the 5 years since the previous study was published. Another feature that contributes is polarization around health and science. And this is something that differs depending on context. So thinking specifically about the United States, we are seeing trends whereby polarization and partisan differences in trust in science are being exacerbated. This might not be new around the world. Trust in science varies widely depending on the context in which you're in. Same with trust in government organizations. When I'm looking for vaccine information here, I do want to find something that the CDC or Minnesota State Health has promoted because they're sources that I trust. That's not something we can take for granted. There are places where the government organizations might not have that same level of trust, creating, again, an information void where if we can't agree on who the trusted sources are, how do we know what is true and what is false? So giving more of those examples of polarization, the pandemic exacerbated these kind of growing trends between Republicans and Democrats here in the United States, where Republicans in particular are showing more distrust over time of medical professionals and medical scientists. And these, of course, have consequences. So looking at COVID deaths per 100,000 people, we see this evidence, this from the New York Times, that death rates are much higher in countries or in counties that voted for Trump as compared to Biden. So Republican counties where Republican elites, many of them have been skeptical of the COVID vaccine, where there is distrust in science and scientists who are promoting the COVID vaccine, and this turning into differences in the rates of death. So again, these real consequences where misinformation on these topics really matter. It's not just social media, of course. Journalists have a role to play in this. And so thinking about the ways in which journalistic norms can actually, in some cases, contribute to misinformation is critically important. So 3 journalistic norms that are particularly important to understand when we're thinking about the misinformation space is first, the need to be timely. So journalism is all about breaking news, being first to break the story, being on top of it. One of the most important features is this new and newsworthy? And those two things are often combined. Because of this, there's both advantages and disadvantages. It means sometimes there isn't as much time for verification, especially when you're trying to be the first to share a news story. It also can create reliance on the same sources of information. And when those sources are highly credible, highly trusted organizations, that can be a good thing. That can mean that our most credible scientists are the ones who are able to speak to the media on this basis because they're well known. There's a reason that Dr. Anthony Fauci is now not just a US name, but a global name in health. He became in many ways the face of science during the pandemic. This can also be a problem if these repeated sources are highly partisan in nature rather than expert, or if they're just not expert at all. So very prominent voices sometimes get outsized attention, just because they're well-known, they're prominent, they're newsworthy on their own, even if the information they're sharing isn't accurate and isn't vetted. Journalists also prioritize conflict. Conflict makes stories interesting and speaks to the human experience. But in doing so, this can create perceptions of conflict where maybe there isn't a lot of conflict. It can overemphasize spaces where there's seeming disagreement or there's portrayals of disagreement that really aren't aligned with what the journalistic or the scientific community exists. This can be reinforced when the norms of objectivity operate, when news organizations are trying to be balanced to avoid being described as partisan or favoring one side. So a he said, she said style of journalism that can apply not just to politics, but also to health. So for example, the New York Times had a story about, they headlined, "These healthcare workers would rather get fired than vaccinated," really making it sound like this is a gigantic problem, that there's real disagreement in the healthcare community, that there is a substantial conflict surrounding whether or not vaccines should happen. It isn't until reading much later into the story that it turns out this is about 15% of healthcare workers in this particular space who are not yet fully vaccinated. And I'm not saying this isn't important. It is, of course, important. And we do want to reach out and understand vaccine hesitancy and what their concerns are. But portraying it as healthcare workers would rather get fired than vaccinated presents a story that I don't think aligns well with the facts on the ground, and furthermore can undermine perceptions of scientific consensus, which are really critically important to motivating people to agree with scientists. Moreover, they found that the nurses union supports the mandate. So 15% weren't yet vaccinated. 95% of members of this nurses union supported it and were already vaccinated. So again, making it sound like there's substantial disagreement when really there is disagreement, but it is not to the level implied. This has been true for a lot of topics. So a well-known study looking at coverage of the claim that vaccines cause autism found that, especially in US news coverage, a lot of the news stories were only presenting anti-vaccine information. This is true for a claim by Michelle Bachmann, a candidate for Republican president back in 2012. She claimed that the HPV vaccine caused mental retardation, didn't offer any evidence for this other than saying that she had a friend for whom this happened. And again, this is years after we should have learned these lessons from the autism vaccine, or the MMR vaccine causes autism debate. They still found about half the stories reported Michelle Bachmann's claim without offering corrective information, without offering the counterpoint that really there is absolutely no evidence of this. And there have been extensive studies to show the safety and efficacy of the HPV vaccine. So again, this is not a single issue problem, but something that we see across health topics, across time, across spaces, where reporting about the misinformation is more prominent than the correction. So all of this, of course, presents a problem. I want to spend the second half talking about what can we do about it. I think there are three main solutions to think about when we're trying to describe misinformation and respond to it. Promoting good quality information, prebunking or preemptively building resilience against misinformation, and debunking or responding to misinformation. So I'm going to talk through each of those. First, I started with that information void. I'm a highly motivated, highly vaccine supportive person for whom I was willing to take the time to find all this information to figure out whether or not my toddler needed a dose. That does not describe everyone. In fact, that doesn't describe a lot of people. There are all sorts of biases and barriers built into that. Knowing what to search, having the time to continue this search and find the accurate information. And then a secondary barrier not related to misinformation. Once I have it, being able to actually do something with it. So we need to make sure that when people are searching information, we are finding for the best quality information as quickly as possible. When we're thinking about credible information, we need to think especially about two things. Credibility tends to be about trust and expertise. Expertise matters, but the one that matters even more is trust. I can be persuaded by somebody who is not an expert who I trust. It is very difficult to persuade somebody or teach somebody if they don't have that basis of trust. So looking for the trusted groups in different societies and using that trust to make sure they're the ones sharing the high quality information. So even with the polarization in the US around medical scientists, medical workers, nurses in particular, teachers remain highly trusted groups that can be sources of high quality information because they have that foundation of trust. So each space in which we operate needs to be thinking about who are these individuals, who are these groups who have these high levels of trust, who we can turn to share high quality information. I have just a short example as well.
We're not hearing the sound.
Can you reshare the slide? You need to optimize it to share sound. There's something you need to check off when you're sharing sound. So maybe you can stop share and reshare.
All right. I think I can just talk through it. My apologies for that. So what this is meant to demonstrate is something that we call weight of evidence. This is meant to address the concern that I raised earlier about journalistic balance and creating perceptions of false balance. So rather than talking about climate change and saying we need to hear from somebody who thinks climate change is real, man-made, and problematic, and we need to hear from somebody who disagrees, that makes it seem like it's a 50-50 debate. Instead, weight of evidence says we need to be talking very clearly about exactly what the scientific consensus is. And this is something both journalists need to be doing and something that health organizations, medical professionals can be doing on their own. So when speaking with journalists, making sure to say, in the case of climate change, 97% of climate scientists agree that climate change is real and man-made. When talking about vaccines, talking about and emphasizing the places in which there is strong scientific and medical consensus about the value of vaccines. So looking at one particular instance of this to demonstrate its efficacy. So this is looking at perceptions of doctors' consensus around COVID vaccines in the Czech Republic. And what they did is first kind of examine whether or not there was in fact scientific consensus among Czech scientists or medical professionals that the COVID vaccine is good. And that is, of course, what they found, that most scientists trusted the vaccine, planned to get it, and planned to recommend it. What they found, though, is when they asked members of the Czech public whether or not they thought scientists agreed that the vaccine was safe, whether they thought scientists were going to get vaccinated themselves, the true value was around 90%. On average, people thought it was around 60%, right? So quite a substantial gap between what the scientific consensus was and what perceptions of that scientific consensus are. And what they found is by informing people of that scientific consensus, they were able to move their own vaccination intentions. So when people learned that there was a strong scientific consensus in their country, that their own medical professionals and doctors wanted to get the vaccine, were recommending the vaccine, were encouraging others to get the vaccine, they themselves said, you know what, I think I will get vaccinated, or I intend to get vaccinated. This is called the gateway belief model. Across a lot of different scientific medical topics, what we have found over and over again is that recognizing scientific consensus really does change attitudes. So a space where journalism has a gap is this potential to promote false balance. A space where we can respond is helping scientists communicate the weight of evidence, that there is scientific consensus where it actually exists. We also can talk thoughtfully about the places where there is uncertainty, so that if we have to come back and say, the best evidence right now is that the vaccine doesn't have any major side effects. But then if we have to come back and say, actually, there is this side effect, and here's the cases in which it operates, having established what we know, as well as where we're uncertain, what we call hedging, can also be very powerful. The second thing we can do is called prebunking. Prebunking involves two steps, ideally. One, warning people that misinformation is likely to happen, likely to exist on this topic. And the second being even more important, giving people the tools to recognize and resist misinformation when they see it. So prebunking is very much built on the analogy of inoculation theory, which you will all be familiar with, this idea that if you give people a weakened form of the virus, their body is able to produce antibodies and resist real exposure to that virus. Prebunking uses that logic in an information setting. If we think of misinformation as the virus, as the pathogen, if we can teach people to recognize it and teach them ways to respond to it, to fight back against it, to understand the ways in which it is misleading or inaccurate, they are less likely to be infected by it to begin with. There are four different strategies that invoke prebunking. There's factual, where we tell people the facts on a topic. There's rhetorical, where we teach them common misinformation strategies. There's source-based, where we teach them common misinformation actors. And then we can finally teach them about how media functions, so media literacy. So to give you an example of rhetorical prebunking, the FLIC analogy acronym came out of studies of climate change misinformation. And what Dr. John Cook found is that almost all climate change misinformation tended to use 5 different rhetorical strategies. So they often rely on fake experts. For example, making somebody seem like an expert when they didn't, making a group of people seem like an expert when they don't have expertise. And that can be quite persuasive. And that's something, again, that while he proposed this theory for climate change, certainly we can think of examples from medicine, from health, where this occurs as well. So thinking back to questions of whether smoking causes cancer, we can think about false experts who are employed by tobacco companies to argue that there is not, in fact, evidence when there is. Much climate misinformation and other misinformation has logical fallacies. So for example, pretending that correlation equals causation, that just because two things go together, that means one is causing the other. And that's definitely not the case. In many cases, two things just go together and there's something else causing it. It can be about oversimplifying. It can be about attacking the people who are spreading good information. There are impossible expectations, and this one is particularly important when we think about the vaccine debate, because impossible expectations sound very reasonable on their face. We can say, well, we want more data. You know what? I'm a scientist. I will always agree we want more data, but that doesn't mean we don't have enough data to make a good decision in the moment. So impossible expectations are always demanding more information, demanding the impossible, and then moving the goalposts so that when we say we have data from 30,000 people demonstrating its efficacy, well, we didn't have data from 100,000, or we haven't taken into account new strains of the virus. That's true, we should keep studying, but it's ever-moving goalpost. Cherry picking is just picking and choosing your data. So we see a lot of this with anecdotes where we talk about, well, this person got vaccinated and then died of a heart attack 3 days later. That is very sad, but people die of heart attacks all the time. That is correlation and not causation, and it's cherry picking a single example rather than the hundreds of people who got vaccinated who are just fine. Finally, there's a specific subset of conspiracy theories where it's not just that there's a specific piece of misinformation, but a bigger worldview that's being implicated, where people see themselves as victims. And importantly, one of the things about conspiracy theories that makes them incredibly difficult is they are immune to evidence. Any evidence that you offer of something being untrue is instead reinterpreted as evidence for the conspiracy theory. So if you try telling them that, look, the government is showing you, or this person, if you try, for example, saying that Donald Trump did get vaccinated, this is good evidence that, he believes in the value of vaccine. Well, he's just pretending, or now he's part of it. He's been taken up by deep state. So reinterpreting facts, arguments against it as evidence for. I'm going to skip the video. I have a link to it, but it's meant to demonstrate the ways in which these kinds of prebunking techniques can be parsed in really simple short terms. It's a 90-second video that was shown to actually improve people's knowledge of some of these rhetorical prebunking techniques. Factual prebunking is telling people where likely myths are likely to occur and giving them the facts before that. The way that this works is because a lot of misinformation is recycled. As we were gearing up for COVID vaccination, we knew that a lot of the vaccine myths are ones that we've heard before. For example, myths about fertility is something that has been claimed about a lot of different vaccines. And so if we give people facts in advance of seeing the misinformation, and often tying it as well to the rhetorical strategies, the misleading strategies, that can help people build resilience. So tell people what the truth is, and they will have that in mind when they're confronting misinformation. Finally, it's worth recognizing that while misinformation is a real problem on social media, it's not that everyone is equally at fault or equally dangerous. So one really prominent study found that 65% of all anti-vaccine misinformation on social media originated from just 12 accounts. They called them the disinformation dozen. So these are people, organizations that are spreading misinformation, usually either for financial or political gain. So if we can make people aware of potential biases, of these potential motivations to spread disinformation, especially for well-known disinformation actors, that can help them recognize and not trust the information they're sharing. Prebunking is meant to occur before people are exposed to misinformation. Debunking is using very similar techniques, but responding to specific concrete instances of misinformation. So just like before, you can explain the ways in which the misinformation is misleading, the ways in which it is manipulating facts, the tactics that they are using. You can and should describe what the facts are on the topic, and you can do both of these things, but it's in response to misinformation. So theory is very much the same, but it's not about inoculating, it's about correcting, it's about replacing the wrong information with accurate information. When we think about this debunking, and we think about it specifically in the context of social media, I think it's really important to recognize that what social media offers is public correction. And this matters a lot because it produces what's called observed correction, which happens when bystanders witness correction. So often when we think about the misinformation problem, we think about one person sharing misinformation, and we all have that person in our lives. So I think about my uncle who spreads a lot of misinformation on social media. And when I think about correcting him, it seems like a really huge uphill battle. And I've tried. It is a huge uphill battle. But when he shares misinformation on social media and I correct him, I need to be thinking about the value of correction, not just in making my uncle less misinformed, but in being able to influence a much larger audience who sees this interaction. So if he is sharing vaccine myths and I'm responding, I might not change his mind. He's in fact the hardest person to change. He is so deeply convinced of this topic that he is willing to share and put his face behind it. So changing his mind, difficult. All the people witnessing it, though, are much more reachable because they don't have a dog in the fight, so to speak, or they have fewer kind of mental barriers in place to resist the correction. And so what my work has shown is that these kinds of corrections consistently reduce misperceptions among that secondary audience. And so this is looking at a lot of different topics. And looking at decline in misperceptions as compared to seeing nothing on the topic whatsoever. So it's not just counteracting misinformation, but leaving people better off. And this is true when we think about a myth that Zika is caused by GMO mosquitoes, that fluoride in drinking water is going to reduce public intelligence, that GMO foods cause cancer, the flu vaccine causes the flu, that raw milk is more nutritious and safer than pasteurized milk, that sunscreen is going to give you cancer, and that you can just take a hot bath to prevent COVID infection or to make sure you don't get COVID. So very consistent findings with one notable example. And that example is where the misinformation is being spread by a false expert through video. And those are spaces where we need to think about how can we do a more effective job of correcting. If we do want to correct misinformation, we need to react, by which I mean we need to repeat our corrections. Misinformation is often out there being spread by a lot of people. We need the corrections out there being spread by a lot of people as well. So if there is a correction on social media, it's not like, okay, that's been solved. Instead, we need lots of different voices chiming in, offering trusted voices to respond. We should use empathy. Everyone has been wrong. I study misinformation for a living. I have spread misinformation because all that means is I got it wrong. And so when somebody's spreading misinformation, especially when it's innocuous, we don't need to be cruel. We don't need to be unkind. We can be understanding and still be effective correctors, as well as helping us maintain interpersonal relationships. It's not just enough to say what's false. We also have to say what's true. So explaining the misleading tactics, offering an alternative explanation, explaining what the facts actually are. So it's not just saying that, no, the flu vaccine doesn't give you the flu. It's explaining how the flu vaccine actually works and what it's designed to do, giving a short tutorial, if you will, on inoculation theory. So you are not going to get the flu from the flu vaccine. It's using credible sources, and this is one where you really have to think about that audience, because a credible source for one person is not a credible source for another person. It's about expertise, but it's even more about trust. So when I try to correct my uncle, I actually don't use the CDC here in the US. He doesn't trust the CDC. He doesn't find them credible. Instead, I'm more likely to talk about, for example, the Minnesota Department of Health. He's a proud Minnesotan. He still has some skepticism, but he finds them more credible than he does the CDC. I talk about what my own pediatrician tells me. That was actually one of the most convincing things I ever did. I got my sister to get the flu vaccine 5 or 6 years ago when I said, my pediatrician says you can't come and see my new baby unless you get this. That was convincing. I'm not sure if I persuaded her or if I strong-armed her, but she's gotten the flu vaccine every year since. So thinking about who is credible and what their motivations are. And then responding as quickly as possible. The longer misinformation is out there, the more people believe it, the harder it is to correct. The last thing to stress is no one strategy is enough. We need the Swiss cheese. This analogy always appeals to me because I am from Wisconsin, and so cheese, of course, is something that I'm deeply committed to. We need to recognize all of the different actors in this space need to be working together. We need platforms helping to mitigate misinformation, helping to promote high quality information. We might need policies that are designed to reinforce those trends. We need practitioners, we need journalists, we need people, just regular old people. All of us need to work together to mitigate misinformation. I told you about 3 different strategies. The first, of course, is sharing high quality information, because this is something we can be doing at all times. And that high quality information can prevent the information voids where misinformation flourishes. Second, we can pre-bunk when we know misinformation is coming. So when we suspect it's going to be out there, we should be telling people about misleading tactics. And once it's already spreading, we need to be responding. We need to be debunking. And when we debunk, we need to recognize that the audience is not just the individual sharing the misinformation, but also the broader audience who is seeing that interaction, who is more amenable to being corrected than that original person. So much like we think about a Swiss cheese model for managing pandemics, where we need to wear masks, we need social distancing, we need vaccines, when we think about misinformation, we need multiple layers of defense. We need to be giving people the tools to inoculate them to recognize misinformation even before they're seeing it. And because we're never going to be fully successful, we need correction at the end to help respond to misinformation when it continues to spread. The slides will be available, so here's just a few of the resources that I talked about during my presentation. And with that, I think we're ready for question and answer.
Well, Emily, that was just wonderful. So thank you very much. And we do have a few questions that have started to come in. One that came up from two different people, I think, was in response to your example about searching for information about a toddler vaccine. And you showed how the second time you did the search, you got different results that appeared to be customized to your priorities. And I think, maybe you could talk about that a little bit more and, maybe reflect on how that is a good thing or a bad thing.
Well, unfortunately, with almost everything on social media, it could be both. I think that's such a fantastic response, and that could be part of what's happening. So that is a good thing in the sense that the algorithms are, in fact, trying to be responsive to us. They are trying to be responsive to us in order to keep us there, to promote a product, to make money for their companies. But if I keep showing them over and over again that what I want is highly credible government sources, that's the kind of information I'm going to see. And so it's not that the algorithm is a black box, but it is meant to be responsive. So we can actually train it for good. It also means we can train it for bad. If we are continually going to low quality information, we're going to see more of that. So I think it's both on our end, but also it's a space where if we identify these gaps, companies can respond, organizations can respond, and adapt those search results really quickly by working with Google to either make sure that that's promoted, creating more advertising space. And so it is a space where the changing environment of social media, I think really in some cases is problematic. The lessons we've learned about, for example, how to use Twitter in the new Twitter aren't always appropriate, but it also is a space where we can change and we can make things better, both as individuals and as organizations and as, platforms.
Great. I guess I will offer a thought I had when you were talking about the weight of evidence and how it can be helpful to show that, many scientists agree on a particular matter. And I think what occurred to me is that that's what guidelines are for. Guidelines from, professional organizations is a whole group of experts who have come together, reviewed evidence very carefully, argued it back and forth, carefully thought about the wording of their guidelines, but then it comes across as just a single guideline. It doesn't come across as something that represents many, many people. And I guess I wondered, what your thoughts are on that, if that's something you've reflected on as well.
I think that's such a thoughtful way of describing that, because it is meant to be exactly as you described, demonstrating the weight of evidence. But I don't know that that's always what comes across. And so I think that we can engage more with journalists who are aware of this weight of evidence narrative, and we are seeing improvements, even if we are not all the way there. But so from the journalistic side, creating guidelines for them that says we should be talking about scientific consensus and weight of evidence. But also from the health side, making sure that we're communicating, this is not just an organization who did this, but an organization whose job it is to reflect on what the scientific consensus is, and really communicating the spaces where we have really strong evidence, really strong consensus in more clear ways, so that we don't just assume that people know, the CDC says it, and that means they've referenced all of these experts. They just think of it as the CDC. And so, yes, I think we can be doing better in communicating what that is meant, what we know it communicates, and I don't think the public recognizes.
Yeah, yeah. And another question that's come in is from the perspective of an individual clinician, an individual researcher. What is my role? What is my responsibility in handling misinformation?
So this is such a difficult question to answer. On the one hand, we know that having conversations kind of face-to-face with people can in fact be effective. We also know that responding to misinformation on social media can benefit a broader community, especially when you're identifying yourself as a medical expert, as a clinician, as a health researcher. That being said, the downside of all of that is that, especially for very controversial topics, it does open you up to trolling. It does open you up to attacks on your credibility. And so that's something that really has to be balanced about where you feel comfortable responding, where you feel safe responding to misinformation. You can be an effective corrector, but I never want to tell anyone, go do it places where you feel unsafe. So identifying how you want to do it, where you want to do it, what your tolerance is for some of the risks that are associated with it. And I would say we need to put more emphasis on making sure platforms are protecting our experts, protecting our medical professionals who are engaging in this important work of informing the public. I guess the last piece I would say is direct correction matters because it puts the correction right next to the misinformation so that the people seeing the misinformation see the correction. If that's not something you feel comfortable doing, promoting high quality information can be lower risk but still have these prebunking and information void benefits. But unfortunately, anything as relates to controversial health topics does open you up to the risks on social media of igniting trolls or hate groups against you.
I wondered, from the perspective of those outside of the United States, I mean, is this just a problem, here, or how does it vary in different cultural contexts? And the solutions, the strategies that you have walked us through, are they different in different contexts? I mean, I recognize it's a very big, broad question, but I think that our audience has so many people from international settings that they may be wondering, well, maybe this is just a situation in the US.
It is definitely not just a situation in the US. Misinformation is a problem across countries, across lines, because these social media platforms exist across lines. In some ways, misinformation is a bigger problem in non-English speaking countries because social media platforms have dedicated a lot more attention, a lot more resources to addressing English language misinformation on their platforms. So that's one space in which we really do need more platform work being done. And it's leaving a bigger gap in our Swiss cheese where we need other people responding to the misinformation. Another thing to recognize is the platforms differ by country. And so if we develop certain kinds of interventions that are meant for public platforms, those aren't going to operate very well in spaces that are very much using WhatsApp and not Facebook or Twitter. And so in those spaces, some of the solutions that are like organizational or top down just don't operate. What we need is more individuals who are willing to say, actually, dad, or actually, uncle, that is not true. And I can see why you're confused. I can see why you might think that, but here's what we actually know from this highly credible organization. Another thing we have to take into account in every single context is, again, who are those credible sources? Because it is not the same in every country. Some countries have really strong journalistic traditions where saying go to a fact-checking organization is something that is going to actually turn you in up high quality results. Not every country has high quality fact-checking organizations. Not every country has trusted government organizations. Even countries that do, those are not equally trusted. So it is very much a culturally specific set of solutions we need to think about because the problem exists everywhere, but the way it looks is a little bit different.
Sure, sure. And one last question also, it's a big question, but we only have a couple of minutes left. One of our audience members is pointing out that there has been a lot of misinformation and disinformation about HIV that has lasted for decades. So any succinct reflections on that?
Well, the succinct reflection is there is no silver bullet. There will always be misinformation, but thinking about the kinds of misinformation that are most harmful and thinking about the audiences who are most vulnerable to the misinformation and trying to inoculate them, or the audiences who are receptive to correction and reaching out to them first. Once it becomes part of a larger conspiracy theory, that is when it becomes, or part of it, someone's identity, that's when it becomes very difficult to move. So intervening early and finding the groups where we can make a difference is the place to start. And then, continuing to work with groups where misinformation remains is still something we should be doing, but maybe is something that isn't prioritized to the extent of inoculating the vulnerable and treating those who are most amenable to being treated.
Great. Okay, well, this was really wonderful, and it stimulated a lot of interesting conversations and questions in the chat. So that's always good. A couple of people were asking about getting the slides, and so we're happy to tell you that the webinar recording and the slides will be posted on icap.columbia.edu, and I think that might give people an opportunity to link into those video clips that we weren't able to hear, but I think it will probably work with the recording and the slides. And then I want to just mention that we have our next grand rounds on Tuesday, May 16th at 9 a.m. On malaria. We focused on the malaria vaccine implementation effort and will be presented by Dr. Mgawaya Magafu and colleagues from the Malaria Vaccine Pilot Program with WHO Africa. So please do join us for that next grand rounds on May 16th. Emily, thank you so much again. And thank you for persevering through last week's technical challenges. And I'm really, really pleased that we were able to bring this all together. So thank you very much.
Thank you all. I really enjoyed being here.
Take care, everybody.